remember that it was 30th of August this year, say around 10 a.m., that I was informed that Shweta is admitted at 26 weeks of conception with preterm labor. Now, if possible, any neonatologist and even obstetrician, when they can't delay the pregnancy far longer, at least want to buy time of at least 48 hours so that they can give an injection to the mother. It's called dexamethasone, which matures the lungs, which matures the brain, and maybe it also matures the intestines. So it enhances the what's called surfactant production, reduces the need for mechanical ventilation, and it prevents a particular kind of a brain hemorrhage in preterm. It's called intraventricular hemorrhage, and it also prevents a condition called, maybe reduces the incidence of a condition called necrotizing enterocolitis. But in Shweta's case, that was not possible. She came, I think the admission delivery interval was just about 2 hours. She delivered a male baby around 12:32 p.m. A baby didn't breathe. So what I did was, it was a preterm vaginal delivery. What I did was, initially, since baby wasn't breathing, I tried to give him artificial breath with an equipment called TP resuscitator with a face mask. Baby came around for a little while and then stopped breathing again. So I had to intubate the baby in the DR, the delivery room. And then I started ventilating the baby with the TP resuscitator. And then we shifted the baby to the NICU, incubator with a transport ventilator. And we started ventilating the baby. Now, since the lungs were stiff, I gave him an injection in his trachea. It's called surfactant to reduce the surface tension, which made the lungs more compliant and easy to ventilate. And then, of course, we set up an IV line, started antibiotics, but baby responded nicely to the surfactant and ventilation. And by 6:30 or so, I could extubate the baby to nasal ventilation. So by the time I left the hospital, baby was extubated on nasal ventilation after having received surfactant. Now, the fight for salvaging such babies is rather, should I say, a battle of attrition. It goes on and on and on. There are so many complications that could take place. Infection is a risk that is, looming large, lingering all the while, lurking somewhere. We have to prevent it at all costs because their immunity is compromised. That requires a scrupulous attention to asepsis. Their feeding is difficult. They have frequent episodes of feed intolerance. Their brain is at risk of brain hemorrhage, as I said earlier. The list is rather long. I wouldn't like to dwell upon it, but just want to tell you that it's not that you ventilate the babies, give surfactant, and the battle is over. The other thing that I would like to highlight is that the role played by my nursing staff was tremendous. After I had started the ventilation, I had given the surfactant, I can tell you something. It was totally a fight waged by my nursing staff because we used only a peripheral IV line. And by day 8 or so, we had removed that line also because baby was on full feeds. We use human milk for nutrition, which is something that I'm so very proud of. And these girls, this baby would have frequent episodes of apnea. He would stop breathing. So the nursing staff had to feed ever so slowly and then had to stand by the baby all the time. You couldn't leave the baby for a minute for the first couple of weeks. And we gave an injection called caffeine, and we put the baby on a mode of ventilation called nasal CPAP to reduce the incidence of apneas. I think by 2 or 3 weeks or so, the apneas were manageable. The other thing that I want to, which can't go unnoticed, was Aditya and Shweta's faith in us, which was absolutely blind. After I gave the initial prognostication, which was rather detailed, we give a very detailed prognosis, But after that, he hardly spoke to me. He would come, see the baby. I would wait for him. But when I would ask him, shouldn't I tell you more about your baby, he would just smile and say, sir, I have faith in you. And I think this abiding faith of Aditya and Shweta was our strength, which made our task so very easy, because we are committed to our babies. The passion that all of us, and it's not only me, my attending pediatrician, the nursing staff, that's unflinching, undying, and is relentless. I must tell you this. You can't salvage babies by equipment, or you can't salvage babies by yes, that's very important, the hand washing facilities, the temperature maintenance, the kind of incubators that we've got, they're the best in the world, no doubt about that. But it's the human spirit that endures, that salvages these babies. That's something that I just can't, stop talking about. By, let's say about, we discharged the baby just about last week or so, when baby was 36 weeks and 2 or 3 days. And at the time of discharge, baby had no retinopathy of prematurity, a condition of retina which can lead to blindness. Baby had no intraventricular hemorrhage. Baby had no infection. Now, all these things, and baby was, as I said, was breastfeeding on mama's milk. Now, all these things would improve the long-term survival, and of course, and not only survival, the intact survival. That means I'm very, very hopeful that Shweta's baby would have a normal neurological, developmental, and neurosensory, that is hearing and visual outcome. But of course, baby would require a frequent follow-ups. But having said that, in view of the absence of usual complications, the chronic lung disease, sepsis, intraventricular hemorrhage, necrotizing enterocolitis, and the fact that is mama's milk that the tiny preterm has been getting right from first few days of life, I'm hopeful, I'm cautiously optimistic that the baby would have a good outcome.
Hi, my name is Aditya.
And I'm Shweta.
So, our journey in Manipal. Well, let me get started on that. So, the problem, we had a baby with low gestational age, basically preterm baby. He was born at 26 weeks and 6 days. We had no complications in our pregnancy at all. So, all the tests, all the reports were normal. There were no signs. But this one day, my wife had a little discomfort, and we immediately visited the hospital, wherein we found out that the baby needs to be delivered. At that point in time, the gestational age was 26 weeks and 6 days. So our treating doctor, Dr. Ashok Saxena. So yes, he's our treating doctor, and he took care of the baby. And today the baby is doing very good, right? So he's with us. He's aged at 37, almost 37 weeks now. So he's doing well. Dr. Saxena, I must tell you what a good doctor he is. Initially, I had no hopes. I had very low hopes. To be very frank, to be very honest, I indeed shed a tear or two as well. So there were a couple of doses. I think surfactant, which was supposed to be there in the baby, if he had been a normal delivery, right? So surfactant was missing, and he was injected surfactant. So this would essentially help the baby in expanding and contracting his lungs in order to breathe.
And then he was on ventilator also.
Right. I think
for
for
some time.
7 days, 10 days,
Yeah.
he was on ventilator support as well. Then again, I would really like to thank Dr. Ashok Saxena
Because we
firstly.
just crossed our fingers and trusted the doctor, and
Right.
he
So
did his magic. And today we are here with the baby.
yeah, the baby is here because of Dr. Ashok Saxena. I must say this. The services at Manipal Hospitals are very good indeed. So this journey of 2.5 months almost now, they've been very good. So the staff here is all very much cooperative, right? So they listen to your problems, and they are in fact proactive. I must say they are proactive. So this one example is with regards to the feed of the baby, wherein we were having, the feed was low at a point in time. So the doctor proactively took a note of it and advised what needs to be done. He also directed us to a milk bank in order to get the donor milk. By God's grace, the donor milk was eventually not required, but then again, we knew that a baby would not stay hungry. So, yes, Manipal Hospitals is a very good place. I think this is the best place that one can come to get the best treatment.
Yeah. In the end, just thank you to the whole NICU team and to the Manipal Hospital for their services
And their support.
Yeah, and their support. Thank you.